All right, good afternoon or good morning, depending on where you're Zooming in from. And thank you for joining us for our discussion on psychiatry residency programs. My name is Dr. Alden Landry, and I will be introducing our panelists and moderating our session for today. Just to give you a little bit of background about both the Office for Diversity, Inclusion, and Community Partnership and about the Visiting Clerkship program to help frame our discussion. So today's webinar is hosted by the DICP. The mission of the DICP is to advance diversity, inclusion, and health, biomedical, behavioral, and STEM fields and ways to build individual and institutional capacity to achieve excellence, foster innovation, ensure equity in health locally, nationally, and globally. The DICP efforts support the career development of junior faculty, trainees, and students. We identify and train leaders in academic medicine and health policy, and we provide programs that address crucial pipeline issues such as this. One specific pipeline program that we do is the Visiting Clerkship program. Today's program is the 6th webinar in the 2021 Visiting Clerkship program webinar series. For 30 years, the VCP has been a model of excellence, offering outstanding medical students, particularly those from underrepresented medicine backgrounds, an opportunity to participate in externships at Harvard Medical School and its affiliated hospitals. Since the inception of the program, over 1,500 students have rotated through the VCP. As with everyone, we have been drastically impacted by COVID-19, and we recognize there's always some uncertainty that comes along with the application cycle, and we recognize that this application cycle is no different, but maybe heightened because of the COVID pandemic. So with this in mind, we're hosting a series of webinars to bring our HMS residency programs and medical students together to share ideas, support, and address questions on transitioning to the next stage of medical training. These webinars provide an opportunity to discuss the application process, address questions from students regarding away rotations, and other concerns that students may have. Just a couple housekeeping notes. The chat is not available and all microphones are muted. However, you can use the Q&A session to post questions to the panelists. And this webinar is being recorded and will be posted on our DICP website. And with that, I want to pause and transition to introduce our speakers, because that's what you're really here to hear about and hear from is our panelists. So I'll introduce all of our panelists, and they're going to give us a little bit of a heads up about their residency programs in particular. And then after that, we're going to jump right into the heart of the questions. So first, I would like to introduce Dr. Shireen Cama. She is a child and adolescent psychiatry program residency director for Cambridge Health Alliance. Next is Dr. Monty Meyer. She's the interim program director for the Brigham and Women's Hospital Psychiatry Residency Program. Dr. Christie Sams. She's the program director for the Beth Israel Deaconess Medical Center Psychiatry Residency Training Program. Next is Dr. Nkechi Conteh. She is the Associate Program Director for the MGH McLean Psychiatry Residency Program. And last but not least, Dr. Deisy Ramirez, who's the Interim Program Director for the Harvard South Shore Psychiatry Residency Program. And with that, I'm going to turn it over to each of the program directors, and they can talk about their programs and tell us what makes their programs unique. And first, I'll turn it over to Dr. Cama.
Thank you so much, and thanks for the opportunity to be here with you all today. I'm a little bit of what you would call a CHA lifer. I rotated there through medical school. I did my adult residency training and my child training there before becoming faculty. So it's an institution that I really love and a program that I really love. I think that Cambridge Health Alliance really offers a very unique synergy with the community and the academic missions that are so core and central to Cambridge Health Alliance. We really try to focus on the surrounding communities and our catchment area. We have a very diverse patient population, many different languages served, immigrant communities. The social justice mission is very core to Cambridge Health Alliance, and there are plenty of people within the Department of Psychiatry who have been there for years because they're so dedicated to this mission. We really offer a very rich interdisciplinary training. We have 32 adult psychiatry residents, so 8 each year. There's 10 child and adolescent psychiatry fellows, so 5 each year. We have a CL fellowship, which has a really nice focus on integrated care. And we also have a geriatric psychiatry fellowship. So there are lots of opportunities to grow within the department. We have a multidisciplinary approach. So a lot of our work is with fellow trainees and faculty in social work and psychology. And we have many specific kind of specialty training opportunities and teams. Integrated care, as I mentioned, both in adult and child. Women's mental health. We have a renowned victims of violence outpatient service. We have cultural and linguistic teams in our outpatient psychiatry department, addictions teams, a first episode psychosis team, school-based clinical teams. We're very well integrated into several of the schools and the communities we serve, and really an emphasis on population health, outreach, and research. And just finally, we really do try to focus on the psychosociocultural framework, including a really rich emphasis on all types of psychotherapy skills in addition to biological treatments. So thanks very much for the opportunity to speak with you.
Thank you for that. Next is Dr. Kante.
Hi, everyone. I am Nkechi Kante. I'm the Associate Program Director of our residency. And prior to that, I was the Assistant Program Director for Diversity and Inclusion. And I would really just talk specifics that I think will be really important for medical students considering our program. It's a combined program of two premier health institutions, McLean, which is an independent psychiatric facility that provides specialized psychiatric care, both inpatient and outpatient. So at McLean, you have the opportunity to work on a first break psychosis unit, on a trauma specialist unit, in addition to the outpatient experiences. And then we have MGH, which is a tertiary institution focused on medical psychiatry, emergency, and community psychiatry. And also both institutions are heavily focused on research. With this combination, we have access to over 600 faculty, both full-time and part-time, and including the current, or the APA president-elect, Dr. Rebecca Brendel. She's affiliated with MGH. We also have legacy in terms of Chester Price, who coined the term microaggressions, and we have the Global Psychiatry Center is named after him. So we have access to these opportunities for our residents and even medical students who rotate here. Our primary teaching sites on MGH, McLean, and community health centers. We have health community centers at Chelsea, Charlestown, and at Revere, and each center has very diverse populations. And if you go to Chelsea, the Hispanic population, you have access there, and residents have the opportunity to request for specific community rotations that they want to do. 25% of our residents identify as URIM, and I think a unique feature, which to me as an international medical graduate is super important, is the availability to have J1 and H1B visa sponsorship during your residency. Elective rotations, again, very specific, not common in so many programs, is the ability to do rotations in your first year. So if you're interested in women's mental health, you have the opportunity to cultivate that interest in your first year and do a 1-month elective with them, or with forensic psychiatry. And we have the clinical educator program. We have the psychotherapy program, which if in your 4th year, you're interested in psychotherapy, you can work with, you have a fellowship, you can do with the Boston Psychoanalytical Institute. You can apply and do that as part of your 4th year. And we have the physician scientist program, which this year started a health disparities track. So moving from bench science and incorporating implementation science and health disparities work as well, which it's of utmost importance to many of our URM residents. We also have a child track. And in terms of fellowship, child CL addictions, I will highlight reproductive psychiatry because I'm a reproductive psychiatrist and I'm doing health disparities work there, and global psychiatry as well. And finally, commitment to diversity. Our program has an assistant program director for diversity and inclusion. MGH itself has a center for diversity and inclusion, and you get mentorships through there, you get access to resources through there, you're able to find community with people outside of psychiatry through that center. Psychiatry itself at NGH has a Center for Diversity and Inclusion. The residents have these opportunities as well. We have a residency advocacy committee, really about advocating for rights of residents, for diverse residents, and for diverse populations. We have an anti-racism task force for our residency program. It's made up of residents and faculty who are underrepresented in medicine, and we address issues that come up for both residents and trainees in their clinical work and in their interactions with other staff and faculty. We have a URIM orientation for interns. If you see, look at the picture. My head was cut off, but I was there. We went on a Boston dock tour just for URM residents with faculty. So both faculty and residents went along as part of their intern orientation. And below is the intern barbecue orientation for all interns who started this year. We have URM intern, resident, and faculty luncheons quarterly. Right now we're doing that through Zoom. So you come in and you see a diverse population of faculty and residents too. Okay. And last but not least, we have the URM Summer Medical Student Program that's available for medical students in the first and second year who want to have an experience at MGH doing research. So our website is there. I'm happy to take any questions, and thank you for this opportunity to speak to you all.
Thank you. Next will be Dr. Meyer and the Brigham and Women's Program.
Thank you so much for inviting me. I'm happy to be here. So I'm the interim program director for the psychiatry residency at Brigham and Women's Harvard Medical School. We're actually a fairly, we were combined with Beth Israel as part of the Harvard Longwood Psychiatry program for many years and became our own Brigham program in 2017. So we just graduated our first class of Brigham only residents, which was quite exciting. So just to give a little bit of an overview of our program and our mission. So we have historically been known as a place with excellent, outstanding neuropsychiatry, medical psychiatry, but I think we're a quite well-rounded program because of our long affiliation with Longwood and our ability to kind of harness the overall resources of the Harvard system. So one of the things that we pride ourselves on as a program is sort of the ability for residents to kind of develop an early specialty concentration and elective of interest. You can see the kind of progressing elective time across our program, starting with 2 weeks in the first year and building to 6 weeks by the third year, with the fourth year involving a lot of time for designated elective activities. And so this allows our residents to really think early about a concentration in an area of interest. We actually have a concentration system with concentrations including women's mental health, medical psychiatry, community psychiatry. And after you pick a concentration, you can devote a large proportion of your elective time to either clinical work or research in that particular concentration. So the other thing that we pride ourselves on is sort of having an approach to rotations in which we bring people back to rotations on which they participated earlier in more of a senior leader role, like as a senior resident. So we have consultation, liaison psychiatry, for instance, in both the second and the third year, so that you can come back with more experience and be involved in teaching and mentoring junior residents. So in that way, we have a lot of focus on resident as teacher throughout the program. In the fourth year, we actually have all of our residents complete a senior attending rotation on the inpatient unit for similar reasons. And in that role, they get to teach medical students and their juniors. So that's kind of those are some of the highlights of our program. I think in terms from a diversity and inclusion standpoint, we're really happy about our partnership with Mass Mental, right next door to us. We worked with them for years in the context of the Longwood program, and our residents spend time there in the second year seeing a very diverse and underserved population of patients with serious mental illness. We also have opportunities for rotations there in the third year and the fourth year, particularly with young adults and emerging psychosis. In terms of our support for our underrepresented residents, we're starting we've had a lot of individual mentorship over the years, but are starting a program involving mentorship families, which we're quite excited about, where our residents will be part of a small group of residents sort of mentored by a senior faculty throughout in sort of a family structure, so they can learn from both each other and also their attending mentor. And then we have through our Diversity and Inclusion Committee at Brigham, the vision seminars that many of our residents have been attending, and thinking about their role in in structural racism and identifying diversity, and that has been an important aspect of resident education that we brought into the curriculum this year through participation in seminars through visions. So those are just a few things. Like the other hospitals here, I actually trained myself at Cambridge Health Alliance. So shout out to Shireen. I miss CHA very much. And we likewise have a quite diverse population drawn from the community largely in our EDs, but also throughout our services. So we're lucky to have that at the Brigham as well. So thank you all for being here and appreciate this opportunity to speak to you all. And I should mention also, Margot Funk is the incoming program director, and she will be taking over for me full-time as of August 1st.
Awesome, thank you. All right, next is Dr. Ramirez with the South Shore Residency Program.
Yeah, thank you. It's a pleasure to be here and talking to you. I am Marcela Ramirez, Interim Program Director at Harvard South Shore Psychiatry Residency Program. Harvard South Shore is a center at the VA Boston healthcare system. We have multiple rotation sites in the private sector and state sector. A major strength we have is the diversity in rotation sites that allows the trainees to be exposed to different patient populations. We are committed to support our residents in their learning and in developing leadership, research interests, and excellence in clinical work. We provide a friendly and collegial environment that feels like home, providing a safe environment for learning. And that's something because I train at this program as well. So I have my love and my heart for it. A collaboration with the other Harvard programs help us to grow and support together in a rich academic environment with opportunities to nurture academic success. We are committed to support and help our residents to achieve their goals, and we work one-to-one to develop the best plan possible. We are strong in the areas of geriatrics, addictions, and trauma. It has been a pleasure to be here, and I hope you join our website and check on us. We have multiple tracks, including psychotherapy, research, and we are developing a community track as well. So we hope to see you in the applications sessions. Thank you.
Thank you, Dr. Ramirez. And last but not least, Dr. Sams with Beth Israel Deaconess Medical Center. Dr. Sams, we can't hear you.
Oh, no, thank you. I'm sorry. Good morning. Very pleased to be here. I also trained in the Harvard system in the former Longwood combined Brigham Mass Mental and BI program. And we have also recently graduated our first PGY4 class. Our program is a warm, supportive program, 10 residents per year. We have very strong psychotherapy. We're known for that, but also have experiences in many areas of interest, women's health, psycho-oncology, integrated care. We have a very close relationship with the Massachusetts Mental Health Center and support learning about care of the chronic and persistently and severely ill. We have our research track that we're launching in the upcoming year, strong psychodynamic and CBT therapy training. We have partnerships with a number of outside facilities listed on the right, including the opportunity to learn about LGBTQIA+ mental health at Fenway, college mental health at Harvard University, community psychiatry at Dimick and Mass Mental. We offer electives in 3rd and 4th year, as well as early mentorship in 1st and 2nd year. All of our residents have protected time for scholarly work, including those who are not researchers. And we have a wonderfully rich faculty who have been educating for decades. You can follow us on Instagram. Our Instagram account is at the bottom right. This summer, we'll be offering a virtual experience aiming to give our underrepresented and medicine students an opportunity to take a closer look at our program. That will be in mid to late August. More information will be on our website. And we also have a commitment to diversity, both at the medical center and in our program with an active diversity, equity, and inclusion committees in each setting. And then finally, our institution is committed to healthcare quality and patient safety and has an institute devoted to that, as well as medical education and hosts a medical education fellowship. I thank you for giving me the opportunity to talk a bit about our program.
All right, thank you to all the program directors for sharing a brief insight into their programs. And we're going to jump right into the questions that we have and try and get to as many questions from the audience. And I'm going to stay with you, Christie. Can you talk about this timeline that we're going to be experiencing for this application season for ERAS? And how are you preparing for this, given the changes that are happening?
Sure. So we have a little more time this year than last year. Applicants can begin submitting their applications to ERAS as of September 1 for psychiatry. I strongly recommend that you have your applications in early. Some programs will offer interviews on a rolling basis. Some will wait and review all applications before offering interviews, but you want to have your application screened on the earlier side, so that if you're applying to a program that does rolling interviews, you have the opportunity to be offered an interview when they have the most slots available. Programs will begin reviewing applications September 29th, including the dean's letters, and then they'll start issuing invitations soon thereafter. Rank lists will be submitted beginning by March 2nd, and the match day will be March 18th this year.
You know, I hear you listing out those dates, and it's amazing how quickly they get upon us. And I know students are already have access or can get access to an ERAS token and start working on their application. But just something to remember is what Dr. Sams mentioned was that applications are going to become available altogether, the MSP and the application on September 29th. And I know program directors get really excited about that date because they can start reviewing applications. Shireen, I want to go to you. Given the uncertainty about the application season, and we'll talk a little bit more about that, what are your recommendations for students who are about to go through this process?
Yeah, thank you. You know, I know it's easier said than done, but my biggest advice would be try not to worry too much about it. You know, everyone's in the same boat, everyone's going through the same process. And, you know, I think what's most important is what's been important every single year, which is just to really take time to reflect for yourself and understand why it is that you're interested in psychiatry, and then really do your best to convey that to programs. You know, as training directors, we really know that people come to their decision to apply in a particular specialty for a variety of reasons. And I think being able to convey your passion and your interest in the field is really important. I think given that interviews are likely to be they're going to be virtual, and many institutions may not offer second look opportunities based on their own policies and so forth, I think, you know, I would suggest doing your best to try to figure out what makes each program different, unique, talk to trainees, talk to faculty, and really try to figure out kind of the programs that are a particular fit for your specific interests. Thinking about what is really meaningful and important for you, for your family, for your, you know, for your future education. Thank you.
And Nkechi, the bread and butter of our visiting clerkship program was getting students here and doing this in-person rotations, getting them here on campus. And a number of students are interested in doing those away rotations, but it's really a narrow window for students to do so, particularly at Harvard. How will away rotations be viewed this application season?
I think in general, away rotations are not as common in psychiatry as in other specialties. So compared to other specialties, we don't place as much value on away rotations in psychiatry, and we recognize that many students are unable to do away rotations because of obstacles like finances, personal commitments. Away rotations are also challenging because the student is auditioning every minute of every day. So all that being said, we understand that it's really difficult to do an away rotation, especially in COVID, and we love having students join us and encourage applicants to do so if they're able to. However, we do a holistic application review, and so students who have not done a rotation with us are not necessarily at a disadvantage. Doing a rotation with us does not guarantee an interview, and I would recommend that if you have something you're passionate about in psychiatry, figure out how to do so within your medical institution. So do a community psychiatry project or rotate on a CL service where you are. Thank you.
And that's a great segue from my question to Monty. I was going to ask, if a student isn't able to secure a way rotation, what should they do? And how will those students be compared to those who don't do away rotations?
So I was a clerkship director for years before becoming interim program director. So I always thought about this question quite frequently. I think the most important thing is that, away rotations are not a requirement. Like, in fact, I would say that, as a residency program director, I do not use them really at all in our decision making, with the exception that if we happen to work with someone, they did an absolutely wonderful job at our hospital, that may be somewhat helpful. But we went through a whole year of not having, any visiting students. So it is definitely not a requirement. Please feel no pressure at all. I think the most important thing that you can do is to make sure, I think several things. One is, make sure that you do the equivalent of a good psychiatric sub-internship wherever you are, whatever a good, advanced elective is. And then secondarily, I think as a program director, I really respect students who do a lot of, who supplement their general medicine exposure in their fourth year, who do like an ICU elective or a cardiology elective or something, because that shows me that this is a intern who wants to be prepared for the medical portion of their internship too. And, we're always looking for people who have that, that intellectual curiosity and that desire to be like a well-rounded and well-prepared general physician.
Awesome. And Marcella, we want to talk a little bit more about how students can learn about programs. So if a student has a particular interest in the program, how should they go about letting the program know that they're interested in coming there for residency?
Yes. My first recommendation will be, first inform yourself about the program. Read well what they do, what areas are they developing, what things in research do you want to do, or scholarly work as well. And then try to reach the person that you wanted to be involved with. The best way to interact with the place that you like is to be able to work with them in a project. And I have seen many residents doing that as they come along in the residency and then eventually join a fellowship, is through that type of work. So that will be my best recommendation, to get to know and then contact the people. And the other thing that I would say is never be shy to ask. You will be surprised how many answers did you get, and find that they want to help you as well.
And Christie, to go along with that, is there value in reaching out to current residents in a program to learn more about that program, or maybe even some faculty as well?
Absolutely. In fact, I encourage all applicants to reach out to residents in our program after the interview. We provide, in most programs, we'll provide a way for you to contact residents. That's where you'll get the nitty-gritty details about what does call look like, and what kinds of things do residents do, and where do they live, and what the real experience is about being a resident in that program. You'll also get a sense of the personality of the residents in that program, and that can give you a sense of whether or not this would be a good fit for you. Faculty as well, it's helpful to contact faculty. I do recommend that you do a little, not a broad research, but figure out who the faculty member is that you're contacting, or ask the program director to recommend a faculty member who would be amenable to speaking with residents and knows the program well. or ask the residents, who should I talk to? If there's somebody with your specific interest, sure, go ahead and reach out to the psycho-oncologist and say, hey, I'm interested in this area. I'm considering matching or applying to your program. How would I work with you if I match to the program? How do you work with residents? So it's absolutely helpful to be in touch.
Awesome. And as we think about the application, students are going to be getting their letters of recommendation and writing their personal statements. I really want to start to tackle what the application is going to look like. But before we do that, Shireen, how can students set up their application to maybe overcome a poor performance on maybe step one or a weak court clerkship evaluation that they weren't expecting? And we understand that everyone had, struggles and disruptions in their education over the past year, but how can students set up their application to highlight their strengths and overcome those weaknesses that they perceive?
Sure, thank you. I think I speak for everyone, all of the training directors here when I say that, as programs, we really take a holistic view of applications and of applicants, especially in psychiatry. I mean, where we really like to get to know the person for all that they are and all that they bring. So I would say, a poor performance on an exam or a clerkship evaluation really should not tank your application. I think identify the parts of your application that are strong, be confident in it, and think about how to kind of put your best foot forward. There are many ways that you can demonstrate your interest and your passion and your skill in psychiatry, working on a project with a faculty mentor, doing taking advantage of a sub-I or an elective opportunity, and soliciting a strong letter of recommendation from faculty who know you well. I think there are many ways that you can kind of really highlight the strengths in your application, which you all have. So I guess I would just say, try not to get too discouraged. And we know that, these experiences don't define a person, and how successful they may be in our programs.
Great, thank you for that. One of the things I always tell students is one exam, one rotation, one quiz, one experience does not define who you are and what you're capable as a doctor. So it's really great to hear program directors reinforcing that. Nkechi, if a student hasn't taken step 2, should they try and shoehorn that in before they submit their application? Will it have an impact on their application? And if so, how will it be? How will it have an impact?
Thank you for that question. So I would say in psychiatry, we don't place the same value on the step scores as other specialties may. And if a student has felt that they've underperformed in their step 1, we would encourage them to consider doing step 2 if possible. But at the same time, in our program, we don't use cutoffs. And we've actually invited students who failed step 1. As we've said here, we look at the whole application, we really take a holistic view. And if other aspects of your application are compelling, like Shireen said, best foot forward, highlight what you have. Again, if you're an international medical graduate and you're considering this, I would encourage you as well, consider taking step 3. But I think it's to reassure you, we don't use cutoffs. And as long as you have a great application, I don't think you should worry too much about how you're doing in your steps.
Awesome, great to hear. And then another part of this application beyond the exams is personal statements. So Monty, any thoughts on what students should put in a personal statement, how to make themselves shine? And I guess the caveat to that question is how much or how little, or should they even talk about COVID at all, given that we've all been impacted by the pandemic over the past year?
Yeah, I think for a personal statement, I think it's helpful to spend some time reflecting on your reasons for pursuing psychiatry, which for many of us are a combination of experiences we've had during medical school and previous undergraduate experiences, and even personal or family experiences. And I think one of those experiences is COVID and the pandemic. And I had read numerous statements last year that had very compelling stories of how people had actually found a passion for psychiatry based on volunteer work that they had done during the pandemic, for example. So I think it's very reasonable to to discuss one's experiences in that with the pandemic in that context. I think it's always, it's good to have, I think with the personal statement, I always recommend working on it with enough time that you can have a faculty member at your institution like read it and, kind of review it for any feedback. It's good to have, at least one faculty mentor look at it, maybe a couple if you have time. And then I think it's also, I think generally, I think anecdotes about family are certainly something that we often see in personal statements, but it's really, I think it's important to really review with your faculty mentors, in terms of the degree of self-disclosure that you want to put in a personal statement. Even for psychiatry, I think keep in mind that anything that you mention in a personal statement can and will get asked about during your interview day. So I think it's good to get feedback about and sort of consider, consider the level of disclosure that you want to get into for your statement. But, beyond that, I think, anything that kind of brought you to your career path is totally reasonable to write about.
Awesome, thank you. And our next question is for you, Marcella. Can you talk about letters of recommendation? Specifically, who should students be looking to turn to get those letters of recommendation, and how can they help those letter writers write the best letter of recommendation for them?
Right. Letters of recommendation are quite important for your application. The number one is choose the person that really knows you, who you are, and how good you are in different and multiple skills that you can show during your clinical work. So they can talk about you and they can present you well. Specific things. So in your letters of recommendations, you have to put a specific purpose, an overview of you and who you are as a person. Sometimes they also have to mention briefly the CV, but not completely everything that is on the CV. And then someone that talks a lot about evaluated skills, like your clinical skills, and be specific. What is good, what are you good at? Other recommendations that I will do into these into letters that I would like to mention to you is, for example, be very creative in terms that, kind of how you're going to present your information. Be careful when you choose the person that is going to write your letter. Make sure that it's a strong letter, and strong letters usually are about 1.5 pages. Make sure that there is no universal wording, because sometimes that goes in all different letters and they put it for everybody the same. So be careful on those. Things that I also recommend that you should do is do your research. Talk with your mentor and what do you want, what are you applying, the purpose of it, why you are interested in it. Give it specific examples and include supporting data. The don'ts, don't be vague or using general language, universal descriptors, or code words. But yeah, that's my best recommendation.
Awesome. And, oftentimes for me, when I get asked to write letters of recommendation, the ones that I feel like I can do best for the students is when they provide me with a copy of their personal statement or their ERAS application, because it allows me to sort of think about how they're approaching this application. So that's one set. And then also, just to highlight something you said, Marcella, is that, go to the people who know you best, and you don't necessarily need to identify the department chair or the most senior researcher around to write the letter, because they may not know you, and the quality of that letter may be a little weak just because of the distance between you and that individual. So thank you for that insight. Christie, OB residency programs have already committed to all virtual interviews this season. What is the plan for psychiatry? Is there something that's universal being planned, or do you think it'll be program by program?
Yes, I think all psychiatry programs are doing virtual, or at least they're being strongly encouraged to do so. So I suspect most will do that.
Well, that makes it very simple from a travel standpoint. But I guess the question, Shireen, is how do students make sure that they shine during those virtual interviews?
Yeah, thank you. I don't mean to be trite, but really, I think just be yourself. That's the best advice that I can give you. I think we've all been in this virtual and telepsychiatry world long enough that now we're able to connect with people over screens, and we know when someone is conveying genuineness and interest. And so I think just be genuine and be yourself. I think this probably goes without saying, but before an interview, you may want to consider your professional appearance in terms of what background are you showing. Make sure you've closed your email and your chat boxes so that you don't get dinged during your interview, and so that you can share your full attention with the interviewer. But I think you can approach it similarly to how you would an in-person interview, and maybe you can even wear pajamas as long as you don't have to stand up.
Oh, the Zoom mullet that you're talking about, business professional up top and casual on the bottom. Yes, very much so. Nkechi, what should students consider when creating their rank list? They've done all their interviews, they've seen all these amazing programs, they've interviewed at all 5 of the phenomenal programs we have affiliated with Harvard. What should students think about when they're thinking about that rank list?
I would actually say take it a step back, and even before the interview season, kind of have a frame of what you want from the residency programs you're applying to. And during your interviews, use that frame to help you figure out if this program would be a good fit for you. I think med students are really concerned about whether they're a good fit for the program, whether they'll be able to keep up, or whether they meet the expectations of the program. But I would recommend that you consider if the program meets your expectations, what the connections you have with residents and faculties. Is there a mentorship opportunities for you in your specific subspecialty of interest? And for your mental well-being, do you have a community mentor there? Would you be able to get that? And if these things are not present, is there an opportunity for that program to grow or to develop such supports for you? So I think, again, the fit, is this program a good fit for you, and can you get support there?
Yeah, and just to echo what you said, it's amazing how many times I mentor students, and they have these complex algorithms where they're ranking and putting numbers in columns and trying to figure out which is the best program. And I think there's something to be said about how did you feel when you walked out of that program, and make sure to weigh that in as opposed to all those numbers that you try and put into categories to assess different programs. So I want to take a pivot now and just talk a little bit more about programs and what they offer to trainees, and less about the application process. So my first question in this sort of segment is for you, Monty. We talk about physician wellness, and there's lots of discussions around burnout for trainees and for faculty. What is your program doing to support their trainees to address this issue of burnout?
I think it's a very important point during COVID. I think many of our programs have struggled with wellness and burnout during the pandemic. And I think it's really brought light on the fact that we are, as humans, we thrive on social connection and context for all the difficult, work that we do as psychiatrists. And I think our residents have been quite susceptible to burnout because of the isolation during the pandemic. And so I think from our program has had, we've really been, we feel like we've had sort of a renaissance of in-person events over the last few months. And, part of that is something that we had started a couple of years ago, but that we had to suspend during COVID, which is our annual resident retreat, which occurs in New Hampshire. So our residents spend a day and then a weekend day at a retreat site in New Hampshire, kind of building program cohesion and connections. And we're doing that this fall, as well as a separate curriculum retreat to really look at didactics overall as a program, and getting our residents' input, since they are the most affected, obviously. And then we've had sort of a series of welcome events for our interns, as I'm sure most programs have had. And then we're planning basically a monthly event over the summer. We renamed our social committee the Social and Wellness Committee, because we realized that wellness was an issue. And that committee, we decided that we need both full program events, but we also need to have class by class events. So we were able to get some department funding going forward for each class to sponsor its own activities, by class as well as by program, because that was something I think during the pandemic that even each individual class felt more separate from one another. So I think my approach to wellness has sort of been thinking about social cohesion. And so if we can promote the sense of our residents as a family, like together, like we can, make a big difference with that. Of course, there are a lot of other things I could say about wellness beyond the family approach, but I think that's always a good starting point. And then our mentorship families as well, I think, are something that we're excited about because it's going to provide another way to build connections within the program.
Okay, thank you for that. And Marcella, can you talk about the culture of Boston, and in particular, how your UIM trainees report their experiences living here? And this is a question that we often get because of the history of Boston and sort of the impression of Boston that others have about the city in Massachusetts as well.
Yeah, I love Boston. I came about 20 years ago, and I still feel it's a strong city. It's diverse with multiple cultural backgrounds. It's a great place to raise your kids. It has so many activities like art, music, museums, food that really express how diverse is Boston and how many opportunities as a trainee and eventually for working you have. About 50% of our trainees actually decide to stay in Boston. The other 50% usually move sometimes. But yeah, that's how likable it is. I feel it's quite approachable, and there is multiple opportunities in different areas, academic, research, work. So that's my perspective.
And one of the things that I thought was interesting is how many of you all trained here in Boston and then stayed on for faculty positions. And I think that's also telling, just looking at, or just raise hands, who of you of transplants came to Boston for residency? Yeah, and you stayed, and I think that says a lot about the city and about the opportunities here. And my just general advice for folks when we get asked this question is do your own research. Come and visit the city if you can. Talk to people who actually live here as opposed to just going on the history, which there's some historical context to everything, but I think Boston is a much different city than what is often portrayed by those outside of our city. All right, Christie, can you share your thoughts on how these programs get along? We have so many residency programs for psychiatry. Is there a cordial relationship between the residency programs and between the teaching hospitals?
So I've been involved in residency education for 19 years, first as an associate program director and now as director. And it's the most collegial that it's ever been. We meet, the training directors from the training programs meet monthly. During the pandemic, we met weekly to find out how everyone was handling all of the unusual things that were coming up. We also meet a few times a year. Once a year, there's a conference in the fall for all residents from all and fellows from all of the Harvard programs. The program directors usually meet for lunch at that time. In the spring, there's an annual research conference for all residents and fellows, and the program directors often meet during that period. And then we consult each other if we have a tricky trainee situation that I certainly have consulted some of my fellow program directors to say, hey, how would you handle this in your program? And finally, our trainees are rotating together. So more than ever, trainees are rotating at more than one of the institutions, and they like it. They like the opportunity to learn from other trainees and learn what's happening in other programs. And sometimes they bring back ideas, and sometimes they say, oh, we don't have it so bad. So it's quite collegial.
I think that's great to hear, especially as the trainees rotate with each other and they do get to know each other, and there's often cross-pollination, right? You go to one residency and then you end up somewhere else for faculty or for fellowship opportunities. And so the trainees get to see the different hospitals and have those different relationships. So we are despite the fact that we're maybe in competing academic institutions, there's close relationships amongst us all. All right, so I actually want to just go ahead and see if there's the two questions that are left in the chat. We'll try and address both on an individual level, so we'll skip those. And I just want to turn to each of you one last time and see if there's anything that you felt we missed out in this discussion, whether it's a piece of advice for students, words of wisdom, something that is going to be integral to the application process that's specific to psychiatry that we haven't touched on, that you think the participants should hear about. And I'll go to you, Nkechi, I'll go to you first.
So I would say that for me, determination trumps brilliance. And personally, I feel if you feel you can do it, then you can definitely do it. And if I, as an immigrant, as an international medical graduate, as a URM, could do this, then you can do it too. Our commitment at MGH is for residents who come to thrive rather than just to survive. And I will say to the medical students watching, shoot for the stars. Don't limit yourself at all. You can definitely, you deserve to be at the best program. I know you might not hear that all the time, but you deserve to have the best ever of whatever you want to do. So please apply to us. We'll be happy to have you.
Awesome. And Shireen?
Absolutely. I think I'll echo a lot of what my colleagues have said, but I'm a really big believer that people thrive in places where they feel supported and comfortable taking risks and, focusing on their growth and their learning. And so what I would encourage you to do is, as you go through this process, really kind of think deeply about what is important to you. Shut out the voices of your family and your peers to a certain extent. Obviously, you can take what their opinions are into account, but really think about what speaks to you. Where is a place that you can be yourself, you can thrive, you can be supported, and really do your best work. And I think that, psychiatry is a wonderful field, especially child. And, we really need dedicated and passionate people like you all to be joining us and to make changes for the patients in our lives. So thank you very much for this opportunity to speak with you.
I like the subtle shout out to your specialty. No qualms with that. Monty, do you have any words of advice?
I mean, I would say, I would just echo everything that's been said. And I think that, sometimes when you're picking I always think when people are picking programs, you have to go with your brain and your spreadsheets that you make about like what all the pros and cons of the various programs are, but you also have to go with your heart and your instincts. Like your limbic system also plays a great role in this decision, and don't ignore your limbic system. Think about where you're gonna think about where you're gonna like fit in and be happy. But it's okay to sort of be not totally sure. You're never going to be totally sure. There's always going to be uncertainty in any decision, and taking a risk for something that your gut is pointing you towards is sometimes okay too. So it's kind of that when you're making your decision, it's kind of that synthesis of your head and heart in a way.
I would expect that to be the perfect answer from a psychiatry residency director talking about the limbic system. I don't think any of our other program directors have mentioned that piece of anatomy. Christie, do you have any words of advice?
Yes, don't be intimidated by big name schools if you're coming from a smaller and medium-sized school. I came from a medium-sized medical school, and once you get here, the playing field is level again. So reach for the school you want to reach for. In your application and in your interview, make sure you're demonstrating why you're interested in that particular program. So that means doing a little research the night before or in the weeks leading up to it, because programs really do want to know, does this person really want to come here? One of the things about the virtual season is that program directors are now getting applications from different parts of the country, and we have to figure out, does this person really want to move to Boston, or are they really considering it, or are they just applying because they can and it's not expensive? So it's important to demonstrate it, to indicate in some way, I have a family member there, I'm really ready to get out of Texas, however you need to express it. No offense to anybody in Texas, just That's, just an example. But any way you can demonstrate that you're willing to be in the city if you're not from New England, make sure you do that.
Well, as a Texan, I'll say that it is okay. You can survive here in New England, even during the winters, and you can always get back to Texas when you need your Texas fix. And Marcella, last but not least.
Yeah, no, I think believe in yourself and what you can do. There is a tremendous amount of opportunities that you should allow yourself to take and fly on it.
Awesome. So we're going to wrap it up here. I want to say thank you to our panelists for joining us, Dr. Cama, Dr. Kante, Dr. Meyer, Dr. Ramirez, and Dr. Sams. Thank you for being here. Thank you for sharing your wisdom. We do have a very brief survey. Hopefully we can put that up. And just to give you some more insight, we do have some future programming. So if you have colleagues who are interested in other specialties, we have our OBGYN residency showcase coming up in August. We have one on surgical subspecialties in August as well. And then we also have our 8th annual Harvard residency showcase where we feature all of our programs. That's going to be coming together on September 11th. So please mark your calendars. If you have any questions, feel free to reach out to us through the DICP. You can reach out to us via email or through Twitter. And for those students who are coming to rotate with us in August, September, October, November, we look forward to hosting you. And thank you for being here, and everyone have a good afternoon or good rest of your day. Take care.